Well, it's a day ending in Y, which means the mainstream media is upset about racism again. This time it concerns the nation's second religion, the National Health Service. Remember that thing that Jeremy Hunt, when he was Chancellor, said made him proud to be British? It was the number one most important thing about the country because at this point we're just a health service with the country attached. And so allow me to blaspheme today, because after the week that I've had, and I'll tell you about it in a moment, the tribulations my wife had to endure, I don't think the NHS is fit for purpose, and I don't really believe that the criticism of frontline staff is due to racism running rampant among the native British population. I think it's because frontline staff are rubbish. The NHS has declined in quality precipitously over the last few decades, especially during, yes, the COVID-19 lockdowns, but the Boris wave. And what has resulted is not just missed cancer diagnoses, avoidable deaths, an escalating budget, and of course people will tell you that the reason that frontline care is getting worse is because it's underfunded. Don't worry, we'll get to that in a bit. But it's not just the bureaucracy indefinitely expanding laterally, it's because the new recruits have a poor grasp of English, they lack compassion, they can't engage in abstract thinking or second order thinking. They treat you as if you are the problem rather than them providing a service to you, and their callous indifference results in critical diagnoses or serious health complications going missed, going untreated, and the medical malpractice suits and payouts escalating to the billions. So, billions in taxpayer cash is being wasted on a health service that isn't fit for purpose, that hires foreigners as a matter of ideology, and is making a series of decisions which ensures, because of ideology, that we just get a worse health service. It doesn't need to be like this. We can make different choices, and I'm going to go through them here. To do some myth busting about our apparently world-class, world-envied health service that just isn't the case, and fixing it, despite all the toes that it requires you tread on, should be the top priority, or one of the next government. So this Sky News piece put out today says that patients are refusing to be treated by non-white staff in the NHS. What they mean is, largely, white British staff who have a good grasp of English and who you can trust actually have the qualifications they say they have, because foreign staff engage in rampant qualifications fraud. And as we'll see, that's not me speculating, that's me quoting The Guardian, of all places. So Sky News report that the Society of Radiographers say the trend over the past 18 months is a poor reflection on society and describe the behaviour as unconscionable. So it is the fault of the patients for wanting to be treated competently based on the experiences that they have. Some have even been refused to be treated by non-white staff, a poll of its members revealed. A sonographer in the Midlands, of Asian, that means Pakistani, descent said, several patients said to her, this country isn't the same with all those people coming over here taking our jobs. That is especially true in the health service, which refuses to hire and train the number of doctors that we have the demand for and subject them to scrupulous, verifiable quality criteria, and instead treat foreign qualifications as if they are equivalent, without stringent verification, without stringent English language requirements, and import them over to fill quotas instead. So there is quite literally, in the NHS, an example of inferior foreign doctors and nurses being imported to occupy jobs that should go to our domestic trained, highly qualified, competent, and eager doctors and nurses instead, who we turn away because we don't want to, quote, devalue the profession. But I'm getting ahead of myself because, believe me, when I read out the reasons for why we have a terrible health service, you're going to be just as infuriated. Sky News writes that such incidents have become more prevalent, blaming the media and certain political parties, reform, where people are openly expressing such views. Yes, those political parties and media, such as mine, exists because people organically have these complaints from their personal experiences. It's not the far right, these external forces injecting artificial bigotry into an otherwise peaceful, cooperative, prosperous, and homogeneous population. No, the population is divided along the lines of ethnic background, culture, certain racial antagonisms that exists mainly between non-whites towards whites, and, frankly, competence and intelligence. Turns out that some of the countries we're getting these doctors and nurses from aren't quite as qualified and intelligent as our own. And so the more of them you bring in, the worse our healthcare system gets. And you're thinking, really? Are you blaming it mainly on the frontline immigrant doctors and nurses? Management too, but yeah, and there's a reason. Anyway, so Sky News prattle on about racism being the #1 problem in the NHS. I'll tell you what the #1 problem in the NHS is. It is appalling delivery. So, just a story, and I'm telling this because it went actually pretty viral over the last couple of days. Nearly 4 million people saw the original post, and then a few 100,000 on the subsequent post. But my wife, 25 weeks pregnant, 2 girls, high-risk pregnancy. So we're being seen at a fetal medical research institute because rather than just being assessed with regular scans at a regular hospital, because of the risks associated with her pregnancy, we need specialist equipment. And for that, again, I'm very grateful. And it's not like she's abnormal as a patient. She's not a geriatric pregnancy, of course. She's very slim, very athletic, has low blood pressure, so that might be the reason for this particular risk that I'll talk about in a second, but otherwise does hours of exercise prior to her pregnancy. She looks good, what can I say? And so she is a model patient. She's not like the disproportionately overweight or products of consanguinity mothers who are black or Asian, Pakistani and Indian, who make up an increasing bulk of births in this country, almost 50% now, who do have disproportionate levels of not just infant complications and at a high level of infant and mother mortality, but also maternal complications like gestational diabetes and preeclampsia because of lifestyle choices, not because of genetic misfortunes or sheer rotten luck. And so my wife seems to have had a bit of rotten luck because for a few days, her legs started swelling. Now again, it's a typical symptom of pregnancy. It's something women suffer from. I do nothing but sympathise. I watch with what she has to put up with, and I help as best I can. But mothers that go through this, and despite all the health complications and risks it poses to them to have their children that they love and cherish anyway, nothing but my admiration. But it was one of her legs. It was her left leg, which is of course a sign of potential blood clots. And as she has low blood pressure already, it was a significant risk. It was getting worse, she was having difficulty walking, she had severe pins and needles, her toes were turning white. All signs of something really dangerous. So she goes to the urgent care centre at a local hospital, a short limp away, and she wanted to see her midwife or someone who could diagnose whether or not this was just regular pregnancy swelling or something to be more concerned about. She waited there for 4 hours, and when they saw her eventually, after she had, I think it was a blood test and her blood pressure taken and a temperature, they said, oh, okay, we can't do this here. You need to go to another hospital, go to A&E. So she had to travel to another hospital away. She went to the initial appointment on her own because she just said, oh, it's probably nothing. It's just a bit of swelling, but I just want to get it checked out, Travelled to another hospital's accident emergency department, waited another 4 hours to be seen, at which point they said, oh my god, you've got probably quite a severe blood clot that we need to use an ultrasound to locate where the clot is, how large it is, how severe it is. But unfortunately, nobody's on staff that can operate a ultrasound today. So we're just going to give you this blood-thinning medication based on your pre-pregnancy weight and send you on your merry way. Now, this is one problem because she needs a course of these injections. And to understand how long she needs the injections for and at what dose, you actually need to determine where the clot is and the size of it. But they hadn't. They gave her one injection and sent her home. So after an 8-hour wait in 2 different hospitals, in an urgent care centre, an accident and emergency, she was sent home. Now, it's fortunate that they actually knew what the problem was in the second hospital, because in the first hospital, as you can see with this screenshot, she was treated by a Nigerian nurse who could barely speak English. And as she was sat there and could see her typing up on the patient notes, she noticed that she had misspelled the word ankle 3 times and then gave up. The healthcare service is so woefully incompetent because the nurses on the front line can barely understand their patients. They can't really speak English. The basic errors are being made at every stage of diagnosis and treatment. And by the way, when she went to the hospital, the second hospital, for accident emergency, this was the same one that we had been to before, in, I think it was 11 or 12 weeks of the pregnancy, where they had mistakenly told us twice that she had miscarried because she was bleeding quite heavily. It was really, really quite worrying. We, again, had an overnight wait in A&E, and she had a physical exam and a face-to-face consultation with the doctor, and they said to us, you'd miscarried. We had to wait 7 hours thinking we'd lost our baby, and I say baby, because we didn't know it was twins at the time, until they decided to do a quick ultrasound just to confirm that we lost the baby, and we found one alive and happy. One. They somehow missed an entire other baby that we didn't even find out about until the subsequent scan that was scheduled for a week or so after. So this is how incompetent, mainly, accident, emergency and urgent care staff are. And I don't want to indict maternity services, even though maternity services have been getting worse across the country recently, because our interactions with the maternity services at this hospital so far have been nothing but positive, and they've been perplexed about how A&E have treated us. So anyway, I put this out initially, because that's when she came home. And then, when she went home, 7 hours after being given the injection, several hours after waiting for blood to be taken, not having an ultrasound, they sent a 25-week pregnant woman home with one blood thinning shot, without a course of the injections that she needed to take later on. Injections she now needs to take twice a day, by the way, that they should have prescribed her, but didn't. We only happened to pick up the prescription because we had to go back to the hospital, because it turns out that the nurses that gave her the injections did not check a number of things, including previous injury, because you're not meant to have these blood-thinning medications if you've had a head injury. And because the toilet door was broken in the first hospital, and my wife, God bless her, is a little bit clumsy, she hit her head on the toilet door while she was in the first hospital. So they gave her the blood-thinning medication after she had suffered a mild to moderate head injury. Now, as a man and an Anglo-Saxon, I have sort of a rugged pragmatism and an attitude of, well, if something falls off, I'll tape it back on, I don't need to go to the doctor, right? So my instinct would be, oh, I won't bother going to A&E and sitting there for ages. But given she's a woman, soft-spoken and nervous, God bless her, I love her, and 25 weeks pregnant and on blood-thinning medication, after that, we went back to the A&E. And it's because when she got home, she collapsed on the floor, went into the recovery position, stopped herself from passing out, but had dizziness and headache. And so we were worried there was a potential complication resulting from thinned blood and a head injury. So we went back to the hospital, and we had to wait 10 hours overnight. They sat a pregnant woman for 25 weeks pregnant for 10 hours in A&E without any offer of food, of course, without the offer of a bed, and I think it's because they were trying to save money on beds. I presume just to monitor her in case that something else went wrong. Again, not offering us the ultrasound on her leg for the blood clot. We still haven't had that. We've had to ring the hospital multiple times. We just rang them just then because they still haven't offered us the appointment yet, which she would then be able to use to get the course of the injection she needs to take to stop a lethal blood clot from developing, because the blood clots can cause stillbirth, stroke, and develop into preeclampsia. So they decided to sit her in A&E for 10 hours before she was seen, and then she wasn't even scanned for the potential head injury or the blood clot. And one of the worst instances, again, was when we arrived at the A&E, and this must have been 11 o'clock at night, we were seen by a triage nurse. And the triage nurse, again, Nigerian, I presume, African man, very poor grasp of English. He was shouting at my wife. And he was telling her, you need to hurry up. I don't want the whole story. This is just an initial appointment. I need to understand. And the thing is, he just didn't want to understand what the actual problem was, which requires a bit of explanation, which is what I've been doing here. Sorry if it's a bit long and complicated. So I, of course, being a husband standing there, said, right, don't shout at my wife. You don't do that. She can't get a sentence out. She's a bit nervous. And he said, sir, if you abuse me again, I'm going to make you wait outside. She's a grown woman. She can speak for herself. Now, at that time, she wasn't. She was distressed. It was late. She barely slept, of course. Hasn't been sleeping much anyway because she's pregnant. And very, very worried about the state of her own health and of the baby's. And then, it turns out that he didn't even take her temperature properly, so he had to go back into the waiting room after we'd finished and take it again. So again, incompetence, vindictiveness, defensiveness. And as we were walking out the room, he said something to the effect of, oh, if you thought I was shouting, I wasn't. That's not sorry, is it? So your tone can completely change after I reprimand you, but then you can accuse me of abusing you when I say, don't shout at my wife who's clearly shaken up by this experience. And this is the problem. Going back to this Sky News piece about the apparent racial abuse that the non-white staff are suffering. And look, if people were throwing slurs out and insults, again, I don't endorse any ungentlemanly conduct, it's not productive. But a lot of this is them getting defensive about being challenged about their terrible conduct. They when you challenge them on it, they know, much like Vikram Digwa at the scene of the crime for Henry Novak's murder, much like various cases I've heard anecdotally before, they know they can play the system by claiming racism to get away with the consequences of their actions. So if they are engaging in malpractice, if they have no bedside manner, if they lack compassion, if they're abrasive or abusive, they can turn around and respond to your complaint with claims of racism and bigotry to get the bureaucracy, which is woke, to side with them and to exculpate them from responsibilities. And so after that 10-hour wait, they sent us home. Oh, the most ironic and disturbing thing as well was that as soon as we walked into the accident emergency service, there was a TV on the wall and it was playing the 2012 film Impossible. It just so happened to be the scene where Naomi Watts' character, Tom Holland's mum, goes into surgery for her leg after the tsunami and thinks she's going to die. So that was a bit, daunting. You kind of got a laugh, or you couldn't write this stuff. It's like a brass eye skit, right? So they sent her home without a scan for DVT, for a potential clot in her leg, which again could be lethal. We still haven't had the scan, and we've only been given a 7-day course of injections. Thank you to the maternity department for telling us how to administer those injections. So at literally every stage, there is bureaucratic incompetence. There is the incentive for people in the system to not make a decision, because if they make the wrong decision, then they could be cost their jobs. But if they just deferred the decision, then nobody makes the decisions, and then it ends up with a problem that then the bureaucracy has to argue for a greater budget in order to investigate and address the root cause of the problem. So, of course, the bureaucracy only expands despite its incompetence and negligence. There were multiple foreign staff. The only effective staff that we saw, again, were English. A really nice English doctor, really nice English midwives and maternity staff who actually cared about the problems, understood what we were saying, understood what second-order effects are, could reason, didn't get angry with us. And this sort of, I don't know, this sense of hostility emanating from some of the staff, the resentment that you were there while they were working the night shift or something, despite the very real danger that my wife was in. Of course, don't get me wrong, some people go to A&E for very trivial matters. I mean, we went to a previous accident emergency when we thought that she had miscarried, and it was like the Mos Eisley canteen. It was full of very fresh, clearly, foreigners who were there for no particular reason, drug addicts that were tweaking out of their minds, just trying to use public money to make up for their own terrible lifestyle choices, and literal convicts accompanied by police officers. So don't get me wrong, there are people that waste time, waste resources in the system, but when you actually need help, the NHS isn't there to help you, no matter how free at the point of use it is. And so my opinion is just, at this point, I don't care what the model is that we need to change to, I just want a health system that works. And there are, beyond the broader structural reconfigurations that you would need to make the NHS work, there are some very clear things that the next government could do that would be popular with the public, that wouldn't be politically costly, that could fix this. And they need to do it because the NHS is just getting worse across the board. So if you look at the wait times, this is according to the King's Fund, again, this is the official NHS sources, the wait times from referral to treatment, the total waiting list is 7.4 million people, comprising 6.24 million unique patients. Some are on the waiting list for more than one thing. 62% have been waiting less than 18 weeks. Now, some of my UK viewers may be so desensitized to crap care that this may sound reasonable to some, or like, well, they're trying their best to get it down. I know that the 25% of my audience that is American is going, what the hell? 18 weeks you're waiting for treatment. I mean, they're perplexed that we could walk into your equivalent of the emergency room and have to wait 10 hours, given the severity of something, and still not be given treatment at the end of it and just be sent home. The median waiting time is 13.3 weeks. And they try to get you seen within a target window of 3 to 4 hours in accident and emergency or the ER, but a lot of cases, you don't get that. And it really is a roll of the dice based on where you are in the country. The most populous areas of the country definitely don't meet those targets. I mean, when we were sat in accident and emergency for 10 hours, we were waiting for, apparently there were 7 people on the list in front of us, and there were 2 doctors on staff all night, but again, we had to wait from 11 o'clock at night till I think it was 9 o'clock in the morning until we were seen for the first time, and then we had to wait even more time for the shots to be given via the pharmacy, and then to be instructed how to use them by the helpful midwives. So waiting lists are really long. People are not just missing out on their treatments in that time and dying, but also diagnoses are being missed. I mean, this is just published today. Among women who are under 50, 95% who fit the criteria for being high risk for breast cancer are being missed. So again, the system is just not catching these life-threatening illnesses and treating them in time. And then if we look at the funding, because of course the chief complaint is that the NHS just isn't funded enough, that the Tory cuts are responsible for the NHS delivering terrible healthcare on the front line. Well, if you look at it, turns out Despite fluctuations in the rate of funding, funding has increased in every single year since 1955. It's increased at sharper rates at times under the Labour government, but even under the last Conservative government, it was going up 3% a year. So, no, it's not that the NHS has had its budget cut. It's not that it is underfunded. It's that the demand is too high, too much money is being wasted, and too many incompetent, uncompassionate staff members are being recruited. Fundamentally, when the budget is 225 billion and it is the single largest employer in the country, there are 1.4 million people working for the NHS on a full-time basis. There's an extra 100,000 staff that are working on a headcount basis. When 1.4 to 1.5 million people are working for you on a £225 billion budget that can only ever increase because it would be politically impossible to say you want to cut funding from it, the problem is the people in the institution and the way the institution is run. The problem is the system and the staff themselves. And again, nobody wants to say it because it's too politically costly, but hey, maybe it takes a guy who doesn't really care about losing column inches in the Telegraph or losing out on an MP safe seat to say these sorts of things, because I just care about the quality of care that my wife and children are receiving, and at the moment, it's utter shit. It's inexcusable, and it could be better. It's not like we have to settle for this. We don't have to live this way. It could be improved. And I'm not exaggerating about the level of demand and the amount of waste in the system. This was found last year by the procurement files on the government website, the Post contracts. A £73 million contract for interpretation services and translation services in the NHS. So we're running an international health service, for starters, where people can show up, and because it's free at the point of use, you don't actually have to show proof of residence or proof of paying tax in order to use the NHS. So you've got people that have never paid into the system, or don't even live here, using the service for free and never paying for it, and just the raw number of bodies in the accident and emergency room clog up the system. If resources are limited or being rationed, then they have to be allocated to people that show up and want to use it. So that means that fewer people in need get seen, whereas foreigners who never needed to be here with relatively minor ailments who just walk into the accident and emergency room get seen instead. And you need to spend billions on actually delivering the care to them. And this is one of the incentives as to why frontline staff are being recruited from overseas, because they are, at least hypothetically, bilingual. Perhaps even trilingual. And so the needs of foreigners who don't speak English or don't even live here and don't pay tax are being prioritised in hiring and care delivery over the native population who, disproportionately, unless you're elderly, do not use the service but pay into it. I barely ever interact with the NHS other than when we're now having children. And so I pay quite a lot of tax, as you can imagine. So has my wife over the years when she was working full-time. And yet, when we want care, we don't get it. But we are paying, contributing to the ever-growing pot of billions in healthcare for random foreigners. But, of course, the problem is always racism. That's the priority. And this is just late last year in October. The government have decided to roll out a brand new strategy to tackle anti-Semitism and other racism in the NHS. Why is there such anti-Semitism in the NHS? Well, that would be because of the number of Muslim doctors and, of course, Muslim patients. But the racism part is the permanent suspicion of the native population when interacting with the diversity that is extolled as our country's strength. And when that diversity does something wrong, and we get a little bit annoyed about it, and do things like challenge them on shouting at our wives and posting to Twitter the fact that they can't spell basic words on their referral notes, then that is deemed racism, and there needs to be a massive strategy to deal with it. All 1.5 million NHS staff are now required to complete updated, mandatory anti-Semitism and anti-racism training, thanks to the government. And that incorporates existing equality, diversity, and human rights programs, and they've now been expanded. So, what this translates to is mandatory anti-white racism, a mandatory suspicion of the native population, which, in addition to potential fraudulent qualifications, a lack of a grasp of English, different cultural attitudes towards compassion, will result in worse care being given to white British people. And just so you know, the NHS is spending upwards of 40 million quid on this every year. So 40 million pounds is going on DEI. 79 billion is going on translation services, and lots more is going on paying people who shouldn't be in the country in the first place, if we just had our recruitment and training practices in order, who might have fraudulent qualifications. And again, you might be saying this is speculative. Well, 2 years ago now, there were more than 700 Nigerian nurses being investigated for industrial-scale qualification fraud because they were getting surrogates, sometimes their children who had a better grasp on English than themselves, to take the tests for them. Or they were paying third-party organisations to lobby for health and social care visas, to present fraudulent qualifications or complete an online test, which would then allow them to move over to Britain and be outnumbered by the number of dependents they imported. I believe for a Nigerian nurse it was 2-1, for Ghanaians it was 4-1, and for Zimbabweans, R.I.P. Rhodesia, what a betrayal, it was 10-1 the numbers of dependents to a health and social care visa primary applicant. So we are quite literally filling up our healthcare service with African fraudsters who barely speak English and who are taught by DEI to be suspicious of and resent white people as institutionally racist. And a follow-up, this was September 2025, found nearly 2,000 internationally educated nurses were being investigated under suspicion of having fraudulent qualifications. And this is also the case for other nationalities and in the social care sector. So in August 2022, there was a 91-year-old woman in a Somerset care home called Barbara Ramel, and she died because when she collapsed on the floor, her Indian and Romanian care workers could not understand the difference between bleeding and breathing, or alert and alive, when phoning emergency services. So their own inability to speak and understand English led to this woman dying. Despite that, as the headline says, the Home Office said that they are not planning to put more stringent English language requirements on health and social care visas. So we, for the last 6 years, in which we saw 6 million immigrants, mainly from the third world, move to Britain as part of the Boris wave, and thousands came in as primary applicants on the health and social care visa, which in 2018 the Migration Advisory Committee warned the Conservative government against doing because they said it would be exploited, it would lead to thousands of low-wage workers coming into the country, and it would lead to them being outnumbered by their dependents, but they pressed ahead with it anyway. This has led to thousands of nurses and social care staff who barely speak English, who are in positions of critical responsibility over sick and elderly people, coming into the country without a requirement for them to actually have the qualifications that they say or be able to speak the national language. And yet, the Home Office Minister at the time, Tom Pursglove, again Conservative, said, "We do not believe raising the level of the English language requirement for skilled workers would be appropriate, and it would be very difficult to assess and manage." No, it wouldn't, actually. Have them take an English test, or stop recruiting from countries which have a poor grasp on English, which have a low-trust culture, which have inferior institutions to our own, a terrible healthcare service, terrible universities. Stop accepting their qualifications as equivalent, and stop accepting them from countries which have high levels of fraud, like India and Nigeria. It's not like Nigeria isn't known for fraud, right? I've got about 10,000 princes that are claiming to be my cousin in my junk email box, saying that if I send them £1,000, I've got $1 million just waiting for me in a Swiss bank account somewhere. Everyone has these. Everyone knows these are the kinds of people that we would be importing if we decided to recruit from these countries, and yet we do. And so it's not shocking when the World Health Organization did a survey of care workers. They found that 2 in 3 staff reported that they had committed abuse against their elderly patients in the past year. Let me just reiterate that. That's not saying that care professionals have caught staff engaging in abuse and reported it. That is the staff themselves saying, yeah, I've been abusing my patients. What are we doing? Why are we putting our loved ones in these scenarios with people that don't understand them, don't care about them, and their fraudulent qualifications or indifference to their suffering could wind up with getting them killed? Why are we doing this? We don't need to do this. We could have our own doctors and nurses. It's not just the Boris wave, by the way. This was a case that came out again today. An Egyptian surgeon has been struck off from his position, not going to prison, weirdly, because he connected the patient's organs together and refused to admit responsibility for it. So this is Dr. Yasser Adli Abdel Rahman, good British name, An NHS locum surgeon from Egypt who qualified in 1993 from Ain Shams University in Cairo. Why are we taking any doctors from that university? Is the Egyptian healthcare service famed for its excellence? I think not. I think if they were capable, competent doctors and nurses, then Egypt wouldn't be like Egypt, Nigeria wouldn't be like Nigeria, India wouldn't be like India, and so on. Anyway, he carried out an emergency bowel procedure on a young man. It meant the contents of the patient's bowel, leaving his stomach, were redeposited back into his stomach through a circular closed loop. So he's basically shitting into his own stomach, because this guy attached his bowel to his stomach. Rahman at no time considered that something may have gone wrong surgically, the tribunal heard, despite the patient's parents and other medics expressing concerns, because the patient was left in uncontrollable pain and could have died if not for another surgeon correcting the error in a second operation. Rahman decided that he was being made into a scapegoat and being the victim of a witch hunt following the operation in 2020. The MPTS has imposed an order restricting his work as a doctor in July of the following year, but then he broke the conditions of the order and applied and secured a job as a locum at Affidea Express Care Clinic in Ireland in February 2022. So, even though they're struck off from the profession, they could be moving elsewhere without that country's knowledge and applying to continue practicing and continue to be guilty of malpractice. So, sorry, how do we know that other healthcare professionals that we've recruited haven't done the same thing in their own countries and have just come over to Britain and haven't had their qualifications checked and are just doing the same thing here? Because we've got proof of it. At this point, there is absolutely no guarantee that the NHS will treat your ailments competently. And that's why, and again, I had to check these numbers, I was astounded. If you go onto the NHS Resolution website, they claim that a record 83% of clinical claims are being resolved without the need for legal proceedings. So you think, oh, okay, that must be saving us money. The NHS aren't trying to take out legal action against people that are taking out legal action against them, that have a medical complaint. 11,110 clinical compensation claims were resolved through dispute resolution processes in 2024 to 2025. So just a year, right? 11,110 clinical compensation claims were resolved without legal intervention. So that means what? About 15,000 total claims? How much was this? 3.1 billion. 3.1 billion is being spent on medical malpractice by the NHS. So this, again, mine and your money, going on paying for people whose lives have been damaged or ruined or even ended by the NHS. 1.3 billion of that were in cases related to maternity. The cost of maternity-based negligence claims since 2019 has been at least 27 billion, which is more than the costs spent on maternity care, 18 billion, in the same period. So the NHS are paying more in medical negligence payouts for maternity-related complications than they are spending on actually delivering babies. And this is a personal thing for me, not just because of my daughters, but as my mother reminded me before recording this video, she had a similar instance to the point of where my birth was used as a case study. It had a journal report written about it because, to cut a long story short, my mum presented to the hospital with contractions at 1 a.m, 1998, and she was left for about 2 hours without being attended to, and I had started to appear in that time. And then they realised that a baby of my size would never have been delivered naturally, so she had to have an emergency C-section only after they realised that I didn't have a heartbeat anymore. So her life and my life was put at severe risk. I think the NHS is still shocked that she didn't sue them at the time, and midwives, when she returned to have my sister, like 15 months later, actually told her, oh, it's you, yeah, we had to write a report about you and change our clinical best practice to prevent that from happening again. So it's not shocking that things like that are still happening. They're happening at an increased rate, and we are spending billions in taxpayer funds on medical negligence settlements. So we've seen rising maternal mortality rates. Now, part of this is because, disproportionately, it's black and Indian subcontinental, Pakistani as well, women who have certain genetic or lifestyle complications like being obese or having many children, and so that increases the risk of each pregnancy, or having children with their cousins. But nevertheless, there are still wrongful deaths that are the result of malpractice by midwives, many of whom, just from the anecdotes posted underneath my post, and bear in mind the reaction to my posts of 1.2 million views, 3.8 million, 3.9 million, and another 750,000 views. The amount of comments beneath saying, I had a similar experience, my wife's life was put in danger, I was ignored by my doctor when I had my children, and I had blood clots as well, or my father was killed by NHS negligence, my mother was left on a hospital bed in a hallway without food and water for hours, confused and delirious. All of these stories, they often mention foreign doctors and nurses being responsible. So, we have people in the country that can't speak English, that don't have the appropriate qualifications, that have a racial animosity against the native population, that blame that population when they criticise their poor care practices, and who either abuse patients in their care in nursing homes, or who fail to diagnose critical conditions, apply the wrong treatments, or even abuse their own patients. And this results in avoidable deaths, injuries, complications that require billions in compensatory payouts. We just don't have to have this healthcare system because the people that are causing the problems disproportionately don't need to be here. And I know what people are saying if you made it this far into the video. Well, Connor, won't the healthcare system collapse without foreign doctors and nurses? Allow me to make a little revelation to you. The government controls both the supply and the demand of the NHS workforce. Again, massive workforce, one of the world's largest employers, England's largest employer. So it means the government chooses the recruitment practices for the NHS. In 2025, we had 15,723 British trained doctors competing for 12,833 NHS training posts. So there aren't enough NHS training posts for the number of doctors that we actually train at home, despite the increased demand for services. Those British trained doctors had already been whittled down from the thousands of other people who apply to train as doctors every year, of whom only half are accepted. Hundreds of those rejected each year have 3 A-star grades at A-level. So it's not like people are applying to the medical profession, but are woefully underqualified and incompetent and being turned away. These are competent people who would make great doctors, who are told they can't become doctors, and then, after they've done the long and arduous process of training to be a doctor, told they can't work for the NHS, simply because of arbitrary caps placed on the system. What's the reason? Because the NHS makes them compete with 25,257 doctors trained overseas. So we are taking in direct substitutions for not just our aspiring doctors, but our own fully trained and qualified doctors who want to train with the NHS and work for the NHS. We are just taking in thousands of unqualified doctors and nurses instead. Why? We could just hire our own people. They would be of superior quality. And we know this because doctors trained overseas are 2.5 times more likely to be referred to the regulator responsible for maintaining standards in the medical profession, the GMC. They are 2.5 times more likely to be referred for medical malpractice. We are just choosing to import foreign doctors whose qualifications are fraudulent, whose grasp on English is inadequate, who are disproportionately responsible for medical negligence. We don't have to. We could just stop doing that, and people's lives would be saved. Billions would be saved in medical malpractice lawsuits. We would have more people capable of treating more people. We could also, other than the ideological doctors that say we're doctors without borders and we don't want to check people's passports or their eligibility to access NHS healthcare because they paid into the system because they're residents, we could instead actually check people's papers and say, sorry, you're a foreigner, you can't use the NHS. We could just stop being an international health service. We could stop using translation services and require you to speak English to access the National Health Service in Great Britain. But for instead, just for pure ideology, as Sam Bidwell points out in this excellent article from 2024, for pure ideology, the NHS insists on not just serving all foreigners, but recruiting foreigners. We have this narrative where the NHS would collapse without immigration. Less than 3% of the over 1 million immigrants imported into Britain every year during the Boris wave were doctors and nurses. And all of those doctors and nurses could be replaced by British trained, qualified, credentialed doctors and nurses instead that we're just turning away for some reason, who are moving overseas to Australia and America. The reason is, the system stems back to 2008, when the British Medical Association voted to cap the number of medical places and ban the opening of new medical schools. Why? Because they feared, quote, overproducing doctors and devaluing the profession. Do you know what devalues a profession? Doctors that commit rampant levels of medical malpractice, that can't speak English and that kill patients, that put the lives of my wife and my daughters in danger. That might lead to distrust in the NHS. That might lead to animosity between patients and frontline staff. That might lead to staff wanting to only see a white British doctor because they're the only ones who understand them and whose credentials you can guarantee are real. It's the same with nurses. Between 2010 and 2021, 348,000 UK-based applicants were refused a place on a nursing course. A House of Lords report from late 2016 found that in 2016 alone, 770 straight A students were rejected from all medical courses to which they applied. So without the British Medical Association's protectionist cap, these students would now be in the NHS workforce. They could have seen my wife instead. So the next government needs to get rid of this cap. Don't allow the British Medical Association, some quango, to regulate the number of doctors that can be trained. Uncap it. Oh, how terrible. We produce the best doctors and nurses in the world who can then go and work overseas if there is an abundant supply of doctors and even improve the healthcare systems abroad. They can go and work in Australia or America. Or, if their ideology leads them to do so, they can go do work in Africa, subsidised by some charity that will pay them handsomely for saving Nigerian babies or whatever, over there, so they don't need to be treated over here by my tax money. All of these things would just be a net benefit for the world, but just purely for ideology. Purely because the NHS is a national religion, because diversity is our strength is the modern mantra of the British state, and because of this arbitrary, socialist, constricted supply and demand strategy towards training doctors and nurses, we just have a worse healthcare system. Things are just shit because the government and quangos choose them to be that way. We don't have to choose this. It could be much better. We could just stop, for example, recruiting Bangladeshi doctors who are 13 times more likely to be referred to the GMC than British counterparts. So we should not only be implementing a red list on certain countries for legal migration, we should not only be ending the health and social care visa pathway, which for some reason Reform UK is still committed to preserving for their skilled worker visa, carve-outs for the salary threshold for critical industries such as care. No, we don't need any foreign health and social care workers. It ends in deaths. We just don't need them. British teenagers, if paid well and trained, will do it themselves. We just need more doctors and nurses to be trained by our institutions. Unfortunately, we have an abundant and willing supply of intelligent young people who want to do it. We're just arbitrarily stopping them from doing it. And of course, that's not the end of the NHS's woes. The bureaucracy is expansive. DEI needs to be scrapped in public institutions. Many administrative staff don't need to be there. They're clogging up the system. The systems themselves are inefficient. They're working on either old fax machines or computers that don't have the sufficient hardware to keep up with the amount of data they're processing. You probably should use some large learning algorithm, AI, to interpolate all this data to ensure that departments share notes, because for some reason the maternity department that we spoke to didn't have access to the patient records from A&E downstairs that we had just seen. It's such a stupid, cumbersome, dangerous system. All these things can and should be fixed. But the first priority is to stop caring about phantom fucking racism and just hire people who are qualified for the job, who can speak English, who don't hate their own patients on the basis of their skin colour, and preferably are trained here with institutions we can trust. I don't care about hospital staff's hurt feelings. I care about the health of my family. And if you can't guarantee that, you shouldn't be in that job.